Hello, everybody. Welcome to today's episode of News You Can Use. Fibromyalgia, is there hope for me? I'm your host, Austin Hopkins, and today is the 19th of February of 2022. We're on the campus of Rocky Mountain University of Health Professionals in Provo, Utah. Today, we'll be discussing a few recent research articles pertaining to fibromyalgia and its possible treatment. Our guests today are Amy Fonger, a fibromyalgia specialist who will be discussing things with us, Matt Wright, a physical therapist who deals with fibromyalgia patients who will be covering physical therapy considerations for this patient, Taylor Mathis, a psychiatrist who will talk about medications that can help, and lastly, Ella Borgerding, who is a longtime listener, first-time caller in need. So to start things off and give some background information for everybody, the CDC describes fibromyalgia as a condition that causes pain all over the body, sleep problems, fatigue, and often emotional and mental distress. People with fibromyalgia may be more sensitive to pain than people without it. Fibromyalgia affects about 4 million US adults, about 2% of the adult population. The cause of fibromyalgia is not known, but it can be effectively treated and managed. Fibromyalgia symptoms can be debilitating and have a very negative impact on person's quality of life. Amy, you're with us today. Talk to us more about that.
Yeah, so just like you mentioned, fibromyalgia is a disorder that affects how you sleep, your mood, your memory, and it's usually characterized by pain and tenderness throughout the body. It's really not caused by any inflammation though, but rather caused by your central nervous system becoming too sensitive. So our brain may automatically create a pain signal whenever a nerve gets fired, and an extra sensitive nerve could lead to an extra amount of pain signals, which is why fibromyalgia can sometimes be called central pain amplification disorder. This is also why people with fibromyalgia feel pain when doing simple things that normally wouldn't cause them pain, like walking or even sleeping.
So what are the treatments for fibromyalgia then?
So general treatments include things like meditation, physical exercise, medication. SSRIs are really helpful, which stands for selective serotonin reuptake inhibitors. But yeah, just those things and just constant self-care can really help those with fibromyalgia.
Well, that's good to know. We actually have a special opportunity to hear from Ella. She's recently been diagnosed with fibromyalgia and would like to get some questions answered from each of us.
Yes,
Ella?
hello. I have been listening to you guys for a long time. I love this podcast. I'm really glad that I could call in today because I do have a few questions for some of the people here, but just a quick story about me. I'm 35 years old. I'm married and I have 2 dogs with an iguana. And I have found that it's easiest to work as a receptionist with some of my fatigue and pain. And I work at the Tesla headquarters. And I just have been diagnosed with fibromyalgia in the last month or so. But I've been having, throughout my life, I've been pretty tired, having a hard time being active and just really stiff when I move around. And then I also have a hard time sleeping. And I saw my doctor a bit ago, and just within the past few days, they put me on Prozac, but they didn't really explain why I have to take it. They said it should help my symptoms, but I'm not really sure about anything more than that.
Well, this sounds like a great question for Taylor Mathis, then, our psychiatrist. Taylor, do you have any answers for Ella?
Yeah, nice to meet you, Ella. I'm sorry you're experiencing those symptoms. That is no fun. One thing you may have wondered is, why the heck did I get put on an antidepressant? And that's fair. There are a lot of overlapping symptoms with depression and fibromyalgia, whether it's fatigue, mood, sleep issues, things like that. And so a lot of the same drugs that we use to treat depression, like Prozac, can be used to help with fibromyalgia. And one way this can work is by helping certain neurotransmitters in your brain that normally will inhibit pain signals from your body. So usually there's signals that go from your brain down to your body that will inhibit painful sensations. But we found in fibromyalgia, sometimes these pathways are not working properly. So if we use Prozac or a different drug, that can help with those pathways and calm them down so they're not as sensitive as they were before. And this can take a little time, usually a week to 2 weeks, to help with sleeping, alertness. It can take a little longer to help with mood, as that's a little more set in stone, but it can definitely be helped as well. A study that you may find interesting was conducted by an individual named Under Ozerbil, and this was in the Clinical Rheumatology Journal in 2006. And so what they did with this article was they took 15 females who had fibromyalgia, and they put them on an SSRI like Prozac, and they monitored how well they were able to exercise as a result. And they actually found that strength was improved in these patients after adhering to their medication. And granted, this study has some limitations. There were only 15 people studied, and there wasn't really a true control, meaning they didn't compare the people who took the medication to no medication at all. But in general, that is what we've seen in our patients, is that there can be a benefit by taking these antidepressants with exercise.
It's very cool. Thank you very much.
Well,
Of
thank you
course,
for keeping us up to date on the research, Taylor.
no
Amy
problem.
discussed other treatments with fibromyalgia as well, like physical activity. Matt Wright is a physical therapist who treats people with fibromyalgia regularly. So do you have any questions for him, Ella?
Yeah, so I only go to PT once a week, but I know that if I move a little more, it should help my symptoms, but I'm not really sure what other activities would be good for me outside of PT.
Well, let me first ask you, what kind of activities do you enjoy?
I really like walking my dogs, and I'll go for a hike with my husband and my dogs occasionally, and playing with my iguana. I do have a membership to a gym, but I don't go that often at all.
Okay. Well, yeah, you mentioned walking and hiking. Those are, aerobic type exercises that are really beneficial for patients with fibromyalgia. So I'd encourage you to keep those up. Some other things that are helpful is, have you ever heard of Tai Chi or Pilates?
I know that the gym I go to sometimes has Pilates, but I've never been to it.
Yeah, those, very calming type exercises that get you moving are very beneficial as well. I will say it may be helpful to avoid group exercise at first, just because it's important to go at your own pace. You may find you need to do like 2 to 5 short minute bouts of exercise and rest, and then do 2 to 5 minutes more. So that's one thing to keep in mind. Other things that are helpful are like aquatic exercises in the pool, or regular strengthening exercises with dumbbells or resistance bands. And one thing you'll want to avoid is eccentric type exercise, where you can ask your physical therapist more about these, but it's where your muscle is lengthening rather than shortening. And it's important to avoid these, especially at first, because you could become very sore and a few days after the exercise. And a research article I actually came across recently that you might find interesting as well is, it was in the International Journal of Environmental Research and Public Health. It was published in 2020 in Spain by Izquierdo Alventosa et al. And what they did is they took 32 women and they split them into two groups. And one group did physical exercise for 8 weeks, and the other group was a control group. So they did no exercise at all. And the physical exercise group, they did things like walking, range of motion exercises, step ups, throwing a ball, calf raises, very general type exercises. But they individualized it to each patient so that they weren't, like we talked about before, they weren't overworking themselves. They went at their own pace and eventually progressed. But at the end of the weeks, it was interesting. They found in the physical exercise group that their scores on depression, pain, stress, anxiety had decreased. But their scores in quality of life and self-perceived functional capacity, endurance, power, velocity had all increased. And so it was a really good study to help us see the benefits that can come from exercise in patients with fibromyalgia. One of the limitations to the study was they only compared the physical exercise group to themselves. They didn't compare them to the control group. So we did see statistical significance in the within group, but there was no between group comparisons. And so, it'd be interesting to see if the exercise had gone longer than 8 weeks, if there would be even more benefit, and if they controlled it, if they compared them to the control group, if we would have seen even more benefit. But the takeaway from this study that we can get is that, and how you can apply this to your life, is if you participate in regular exercise, you're going to see all those things increase, because we know exercise, it really helps balance things out in your body, and that, in addition to your medications, I think you'll be able to see an increase in the quality of your life.
That's really interesting. I like your pool idea, so I'll have to try that out.
Ella, do you have any other questions for our guests today?
Nope, those are all of them.
Okay. Thank you for joining us on this episode of News You Can Use. I'm your host, Austin Hopkins. I'd like to thank Ella Borgerding, Amy Fonger, Matt Wright, and Taylor Mathis for joining us today. Catch you next time.